For Your Health, the common sense approach to the worlds of medicine and health. And now, Dr. Bruce Hensel and Kelly Mack with the newest medical advances and procedures that can change your life. And it's all for your health.
12-year-old Nolan Hutane can finally be a kid again thanks to this amazing device. It's called the vagus nerve stimulator. It stops the epileptic seizures that made his childhood miserable. Doctors implanted the device in Nolan's chest. A wire connects it to the vagus nerve in his neck.
And it emits a continuous, intermittent electrical stimulation to the vagus nerve, which in turn sends a signal to the brain.
It worked. Just a few months later, Nolan has fewer seizures, he needs less medicine, and best of all,
I can now ride my bike, and I'm going to start maybe baseball or Cub Scouts.
In essence, he has a new life.
it's a medical marvel for your health.
Hi, I'm Kelly Mack, along with Emmy Award-winning medical journalist Dr. Bruce Hensel. Now, 12-year-old Nolan had hundreds of seizures every week. That has all changed. The thing that's amazing to me about epilepsy in this day and age is it's still such a mystery as to why it happens.
Yes, it is. You know, it can occur as a result of a brain tumor or an injury to the brain. But the most common form of epilepsy, we don't know why it happens. We do know that there is something wrong electrically in the brain, some minute thing that we can't see with PET scans, CAT scans, or anything else that for some reason or other sends a discharge from the brain. But here's an aside that's very interesting. Years ago, I don't know exactly when, somebody noticed that epileptics don't get depressed that much. As a result, they theorized that maybe the convulsion has something to do with that. That is the source of shock therapy. Shock therapy sounds horrible, but it really works. When we use it on psychotically depressed people, the convulsion results in a discharge of so many chemicals that afterwards they recover from their depression. So this is one of the side effects. Even though we don't know the exact cause, we do know one of the side effects that we actually turn to our advantage.
It's interesting because my brother has epilepsy, and as you indicated, everyone else in the family seems to have a problem to some degree with depression. He's as happy as can be, although he has seizures that are controlled by, medication.
We're not recommending epilepsy to treat depression, but the point is that when you look far enough into these things, there are some silver linings.
Fascinating. All right, let's take a look at some other medical marvels. Do you keep postponing that dentist appointment? Can't afford the time it'll take to replace your old filling with a crown? This will make your life easier. Instant crowns. First, the dentist removes your old filling. Then she takes a computerized picture of your tooth. With that same computer, she designs your crown.
Wait 18 minutes for that to melt.
In less than 20 minutes, your crown is ready. It only takes another 5 minutes to bond it in place.
They love it. They love it because it's one appointment.
That means no return trip to the dentist. This medical marvel is saving time and saving smiles.
Save your sight with this medical marvel. It's a new camera designed to catch early signs of glaucoma.
Glaucoma is acquired damage to the optic nerve, which may or may not be related to pressure.
Old glaucoma tests just looked at that pressure, but this new laser camera looks directly through the eye to the optic nerve itself. It's painless, and if it catches the subtle early signs of disease, doctors can begin treatment before glaucoma damages your sight.
When the sun damages your skin, it can be deadly. But Scott Burrows survived the worst form of skin cancer, melanoma. When it spread from his leg to his lymph nodes, his doctors gave him an experimental vaccine. They made it from live melanoma cells grown in a lab.
We then inject them into patients that have melanoma to sort of kickstart their own immune system.
That helps their immune system kill the melanoma cells. Doctors inject the vaccine near your lymph nodes. They say it can boost your chance of survival to better than 50%. Scott's melanoma has not returned. A lifesaver and a medical marvel for your health.
Now, many people feel this is the future of medicine, genetic manipulation. We probably all have cancer cells in our bodies at all times, but healthy immunological systems get rid of them. When the immune system breaks down, we don't get rid of them. By altering the cancer cell genetically and injecting it back in, the body goes, oh, it's foreign, and it attacks it, and it attacks the tumor too. That is the bottom line here. That's the way it works.
Yeah, it's funny because some people have real problem with the ethics of gene manipulation, but you can't argue with the fact that it has come up with some real medical advances.
There is a debate, but there is no question that there is a positive side to it, too.
All right. Well, Scott survived deadly melanoma. Many women are surviving breast cancer. Here's one woman's amazing story. Her name is Lori, and she was only 38 years old when doctors found a lump in her breast, an aggressive tumor. She couldn't believe it.
I felt like, don't get me near a cliff because I'll jump right off. I just thought of the things that I had heard of that people go through when they have cancer. I thought, I don't want to do this.
But she had no choice, so she studied the disease.
I just decided I'm not going to die, and I'm just going to have to educate myself.
And she started a journal.
I have cancer. Not even 3 weeks ago, I was just a normal girl.
When her dreaded chemotherapy began, her family was by her side.
It's like I'm on Mr. Toad's Wild Ride. I mean, I don't know where I'm going to end up.
Other young women, some younger than Lori, battled breast cancer too.
I said I would do this so people go like, oh my gosh, but you know what? This is it.
Lori's plan of attack? First a lumpectomy to remove the tumor, then chemotherapy, then radiation treatments, 35 in all. Finally, her last radiation treatment came with tremendous news. Her breast cancer was gone. It was a day she and her family had prayed for. Her best weapons, information, and emotional support.
My work has been great, and family and friends have been great, and that's definitely what's kept me going.
Now, if you find a localized breast tumor, doctors say that even if it's found to be malignant, you have a 97% chance of being cured. Early diagnosis is critical.
Coming up, don't let motion sickness ruin a good time. We'll have healthy advice for trips on planes, trains, and automobiles. And how do you choose a good chiropractor? We've got some tips as For Your Health continues.
These little critters may actually help you heal, really. Leeches in medicine. Now, centuries ago, people used to use these little bloodsuckers for everything from the common cold to cancer. They put them on the back and, I guess, just pray. But now we have discovered something. They actually slow clotting. So if you have an amputation, cut off part of your finger, for instance, the vascular surgeon will put the leech right on the scarred area after the surgery. The leech will slow the clotting process so you'll heal better without a scar and without an infection. It's amazing. Leeches in medicine.
Interesting, but they're still disgusting. Yuck. Here's more healthy advice.
Chiropractors are helping this couple to keep their dancing shoes. Simple adjustments may relieve pain and get you moving around after an injury. But how do you choose the best chiropractor? First, stay away from anyone who makes outlandish claims like these.
I do see some chiropractors who claim that they can treat inner ear infections, urinary tract infections, bedwetting, bacterial conditions, viral conditions.
Avoid a chiropractor who makes you sign a long-term contract. Make sure the chiropractor takes a thorough history and considers x-rays. And if your pain gets worse or doesn't improve with treatment, you may want to see another doctor.
You may want to see a doctor if traveling makes you sick.
It's terrible. I vomit and I get dizzy and feel like my last hours are here.
By car, by boat, by plane, or train, motion sickness can ruin your trip. Our healthy advice? If you can, keep your eyes closed or don't look at the horizon. You get sick when you're moving because your brain gets mixed signals.
The inner ear has organs which detect motion, and your inner ear is telling your brain that you're moving while your eyes are telling you that you're staying still.
These medications may help. Antihistamines like Antivert, prescription patches you wear on your neck, or injections.
The medications work by blocking the connection between the balance center in the brain and the vomiting center.
Whatever you choose, take the drug an hour before you travel and enjoy smooth sailing for your health.
You know, motion sickness has been such a problem with me for my entire life that there are things that I don't do because of it. For example, taking a boat trip, a small boat, for example, taking long trips up through the mountains, I just won't do because I feel so awful.
You have sensitive ears. The way we determine where we are in space, and you know, when we tilt our head, whether or not we're moving, whether we're in a certain position, is determined by little hair cells inside our ears that give signals to the brain. And certain people's cells are more sensitive. If your cells are more sensitive, you won't get the message as quickly, and your body won't realize you're off kilter, and you'll get nauseous. So that's the reason.
And my mother used to always say, just stick your head out the window of the car and breathe in the fresh air. What kind of advice is that?
I don't want to insult your mother or mine. It'd probably make you feel better. You get more fresh air. Just don't stick it out the window at an angle. That may even make it worse.
All right, in that case, Mom didn't necessarily know best.
Sorry, Mom.
Okay, and coming up.
Are you scared to fly? Virtual reality may be just what the doctor ordered. And we found a guy who says that your face could reveal a lot more about your personality than you may think, as For Your Health continues. If you'd like to know more about any of the information on today's program, just drop us a line at For Your Health, 3000 West Alameda, Burbank, California, 91523.
I've gotten several letters about the dangers of X-rays, so let me put it in perspective for you. Single X-rays are not that dangerous. X-radiation is cumulative over the course of a lifetime, so if you get a lot of X-rays from the time you're a little child, it could be dangerous. Keep the overall number of X-rays down. But to put it in context, you get a lot of radiation when you're flying in a plane because you're up in the atmosphere much closer to the sun. As a matter of fact, a round-trip flight from LA to New York and back actually exposes you to more radiation than one chest X-ray. Kelly, back to you.
Okay, Bruce, well, a lot of people are afraid to fly cross-country or anywhere. They're afraid of heights, even afraid to leave their homes. But take a look at a new high-tech help for phobias.
Are you terrified by the view from tall buildings? Sickened by the sight of spiders? Afraid to fly? Help is just a headset away.
Okay?
It's virtual reality therapy. Sit down, buckle up, put on a headset, and take off.
Right, I hear the engines.
The experience of having the headset on, being able to get a visual experience, the sounds from the earphones, and vibration in the seat gives a multi-sensorial experience.
You can stand on virtual bridges, ride virtual elevators, or enter a virtual kitchen to fight your fear of spiders.
Grab it with your whole hand.
No thanks.
It began with virtual Vietnam for veterans with post-traumatic stress disorder. Today, across the country, VR therapy is helping us conquer crippling fears. The technology makes it almost as easy as playing a video game.
Now, there are many fears of flying, including the fear of flying with an ear infection, and that you should be afraid of because that can lead to a hearing loss and it can certainly lead to a lot of pain. Now, Kelly, that pain usually occurs on descent as you're landing because the pressures don't equalize very well in your ears. One way to treat that is with decongestants, but these are another way to treat it. I'm going to use this pen.
Okay.
Put a hole in some paper cups and put them over your ears. The reason for that, I look very good. The reason for that is that your eardrum, right, doctor?
Yes.
Yeah, your eardrum is supposed to equalize the pressures when you have fluid in your ears, but it doesn't do it well if you've got a bad infection. This will equalize the pressures outside of the head so you won't feel any pain. It really works.
You look a little bit like Dumbo.
Dr. Dumbo.
Oh, sorry,
See,
Dr. Dumbo.
Dr. Dumbo. If I did this, I'll bet everybody on the plane would start doing it. Become the fashion.
I'll take your advice. Well, those paper cups are very fashionable and useful too. Here are some ways to feel good about the way you look. Could your lips reveal something about your character?
The full lower lip makes her a very generous person.
George Roman reads faces. He calls it personology.
Also, your thin lips makes you a very concise person. You like to speak to the point. The square jaw here, pugnacity. He's a fighter. He needs contact sports, something that will give him an expression for his physicalness.
What about eyebrows?
The V in the eyebrow makes you appreciate design. She has a natural sense for where things should go. See, his eyebrows are pretty much straight across. This is called aesthetic appreciation. These people need harmony in their life.
And he says your nose knows more than you realize.
The ski slope nose, the indented nose that comes out, makes her a helper. She's naturally helper-oriented.
A downturned nose?
Extremely skeptical. Prove it to me and then I'll believe it. The downturned nose. Doesn't accept things at face value. Needs proof or evidence that it's going to work. Right. This is the money nose here, the angular nose. He knows how to shop a price and shop a deal. He knows how to get a bargain. See the flare of the nostrils? When the nostrils are widely flared, this is called self-reliance.
So is he right?
Some is true, some is not.
What do you think is not true?
A couple of things about I'm a fighter. I'm very peaceful man. I don't think I'm a fighter.
No. You don't think so?
No, he's definitely a fighter.
The truth comes out.
It's very true. It's kind of scary. He likes to nose me.
George says next time you meet someone, study their features.
You know how to talk to the person, you know how to deal with the person, because you know who this person is. It's all on their face. Body language.
You can wear a new smile with the latest material for lip enlargements. It's called Fascia, brand name Fashion. It may last longer than traditional collagen, and it may cause fewer allergies. Here's why. Collagen usually comes from a cow, but fascia comes from human tissue.
Fascia is the covering of the lateral part of the thigh, covers the muscle. It's a thick fibrous material.
It's collected from cadavers and pulverized into tiny particles in a lab. A doctor puts it in a syringe and mixes it with numbing medicine. Then he injects it directly into the lips. Here's one woman before and after, and another person before and after the new lip enlargement.
Just ahead, it's hot, it's fried, it's new, and it's actually good for you. Fortified eggs. And if you're watching your caffeine, we put your cup of coffee to the test as For Your Health continues.
Now, do you know which vitamins to take? It can be confusing with all the different studies you hear about. I'm going to make it simple. There are only 4 vitamins that there are absolute proof about. The first is this one, calcium. We know that prevents thinning bones in both men and women. Vitamin E can prevent cancer and heart disease. That is unequivocal now. Folic acid can prevent birth defects in women of childbearing age, but it may also prevent heart disease. And selenium has been shown to prevent cancer as well. Now, aspirin is not a vitamin, but it not only will protect you against heart disease, it may actually prevent intestinal cancer. Now, people should not take aspirin on their own without speaking to their doctors, because some people have problems with aspirin. It can cause problems with the stomach or allergies. So check with your doctor first. But these other 4 vitamins you can take safely and preventively to prolong your life.
What about all those B vitamins that you see? I mean, you know, B6, B12, all that, and vitamin C. You didn't mention those.
Well, Linus Pauling really gave vitamin C a boost, and he was a Nobel Prize winner. But there's absolutely no proof that if you don't have a deficiency, that vitamin C makes a difference. Now, I know it seems to help prevent colds, and I take it myself. It's not dangerous as long as you take fluid with it, but there is no proof that it prevents disease, and that is also true with vitamin B. Now, vitamin B may raise your energy. There's no bottom line to staying away from it, but these are the only 4 that there are absolute proof about. But you should start taking these, and men and women over the age of 50 should take this. Men, too, should take calcium, and women at any age should take calcium. Vitamin E, folic acid, aspirin if your doctor tells you it's safe for you, and selenium may prevent disease and prolong your life.
That's easy to remember. Okay, well, you don't need a prescription for any of those, but before we go, let's take a look at some other remedies and foods that are good for you and available right off the shelf.
Here's something new for you in the market, an egg fortified with DHA and omega-3 fatty acid.
DHA oil can lower triglyceride levels. It helps keep the blood thin.
And that may protect against heart attacks.
What we do, again, is just feed the hens a little bit of the DHA in their diet.
Scientists figured since fish get DHA from eating marine algae, chickens can too. So they're processing the algae into chicken feed. What the hen eats gets passed on to her eggs. Each egg ends up with 150 milligrams of DHA.
Tastes pretty good.
And may be good for your health, right off the shelf. You want to avoid the jitters that come from too much caffeine.
I drink decaf.
You don't want a stomach ache.
Decaf.
Or you're following doctor's orders during pregnancy. Be careful. Some decaf carries more punch than you'd expect. An average cup of decaf should have 2 to 5 milligrams of caffeine. But look at what we found in Miami. The decaf from Burger King was on the money. McDonald's was just a hair above. Dunkin' Donuts, over 13 milligrams, more than twice the desired amount. A cup of Starbucks Decaf Guatemala was just above 8 milligrams, but our test cup of Starbucks Decaf House Blend, it had nearly 134 milligrams of caffeine. That's 25 times higher than what you'd expect. Now, Starbucks said something went amiss, and we got a cup of regular coffee instead of decaf. That may explain why some decaf drinkers are sleepless in Seattle and elsewhere. It's decaf disclosure for your health.
The material contained in this program is for informational purposes only and is not intended for treatment, diagnosis, or consultation. Always consult your own physician before beginning any course of medical treatment.
Nice one!